Welcome back to Diabetic Foot Files, the podcast where we uncover science, stories, strategies behind every saving limb and improving lives. So, today's episode, we're going to focus on one particular medication that many clinicians have heard of, and especially vascular doctors, right? But when it comes to diabetic foot ulcers and wound healing, some people do prescribe this, and it's pentoxifylline. Okay, let me just spell that for you: Pentoxifylline. It's a fancy name, pentoxifylline. And this is a drug that has been around for decades. When you hear this drug, clinicians, I mean, for me, right, I'm not a vascular doctor, but I just immediately think intermittent claudication, right? I associate it with that. But this drug has been around for decades. And, like I said, make common sense common. This is not like medical advice or anything. This is for education purposes. Okay. Nah. So, it doesn't, make headlines like GLP-1 medications right now, right? But yet, a lot of our vascular specialists, wound care physicians, and even podiatrists continue to use it for one simple reason. It may help blood flow reach tissues that desperately need oxygen. So today we're going to discuss what pentaph- pentoxifylline, y'all have to forgive me, nobody's perfect. Pentoxifylline is, how it works, why diabetic ulcers struggle to heal, the role in blood viscosity. Remember, we talked about how thick the blood viscosity is in a diabetic ulcer, peripheral arterial disease, what the science says, pearls, and so on. What's the future holding for it? But before anything, I love to go into the history. I don't think I'm a history nerd, but I love me some history. So, in the beginning, so in the 1950s and the 1960s, vascular researchers realized something surprising. Patients with peripheral arterial disease, PAD, didn't just have narrow arteries, their blood itself often flowed poorly through the tiny capillaries, and blood was thicker, the red blood cells were less flexible, and the circulation through the small vessels became sluggish. And at that time, most therapies focused on opening up the arteries. But a group of researchers in Germany asked a different question. What if we can improve the flow properties of blood itself? And that question eventually led to pentoxifylline. And so Pentoxify Pentoxifylline, okay, was developed by a German pharmaceutical company called Hoechst AG, and I'm just gonna spell that Hoechst, Hoechst AG, and that was one of the largest European drug manufacturers at that time. And scientists were studying a family of compound called xanthines. 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 Okay, I hope I'm pronouncing that right. And that's the same chemical family that includes things like caffeine, which we all use, let's not lie, theophylline, and theobromine, which is found in chocolate. And these compounds were already known to affect the blood vessels and the circulation. Everybody knows what caffeine does to us, right? Researchers have began modifying the xanthine molecule, hoping to create a drug that can help improve microcirculation without causing excessive stimulation like caffeine. So during their laboratory testing, researchers synthesized what became known as pentoxifylline, a synthetic methylxanthine derivative. And when they tested it, they noticed something beautifully remarkable, that the red blood cells became more flexible. So the red blood cells were kind of doing gymnastics, okay? We want that, right? Or what is the contortionist, right? And instead of behaving like these stiff discs that were struggling through tiny capillaries, the cells could bend and deform easily. And this was quite important because some capillaries are narrower than the diameter of the red blood cells. And healthy red blood cells must squeeze or flow through that, okay? And researchers discovered that pentoxifylline improved this ability. Awesome, right? They turned the red blood cells into contortionists. I love contortionists. They're cool. So the scientists then measured the blood viscosity, which is what is blood viscosity? Resistance of blood to flow, right? And they found out that pentoxifylline appeared to reduce the blood viscosity, improve the red blood cell deformability, reduce platelet aggregation, and improve the microvascular blood flow. And suddenly, researchers realized that it wasn't just a simple vasodilator, that it changed the rheology of the blood itself. And that led to a new category of drug called hemorrhagic. You'll have to hemorrhagic drugs, and these are drugs that help improve the flow characteristic of blood. So, who was the first patient? So, earliest clinical studies focused on patients with intermittent claudication. We know that's a big thing for us, especially with our diabetic patients and our patients who have PAD, right? There's a lot of patients have PAD. So these patients, what is intermittent claudication? They experience leg pain while walking, right? That's one of the key factors, and reduced exercise tolerance, and then they have poor arterial circulation. And researchers found that some patients could walk further before pain developed after they were taking pentoxifylline. And that was enough for them to generate excitement into that world of medicine. Now, pentoxifylline entered the European market in the early 1970s. So it's still an early drug, an early baby of a drug, in my opinion, because that's really young from the 70s under the brand name Trental. It was called Trental. That's the brand name, okay? And then it was marketed in Europe since 1972. For more than a decade, physicians in Europe used it for peripheral vascular disease before it eventually reached to the United States. The FDA approved pentoxifylline in 1984 for intermittent claudication associated with peripheral arterial disease. Now, another interesting discovery that they found was years later, scientists learned something that they didn't know when the drug was created. Pentoxifylline wasn't only affecting the blood flow, it was actually influencing the inflammatory signaling. So, researchers discovered that it could reduce the production of inflammatory mediators such as TNA alpha and alter the cytokine activity. So, this opened entirely a new area of research for things like diabetic complication, chronic wounds, radiation injury, fibrosis, venous leg ulcers, and liver disease. And scientists suddenly realized that they had accidentally created a drug with both vascular as well as anti-inflammatory properties. Isn't that beautiful? So why does us as wound care physicians care about this? Pentoxifylline seem to almost be tailor-made, right? Because our chronic wounds often suffer from poor microcirculation, increased inflammation, sluggish oxygen delivery, high fibrin levels, and impaired capillary flow. And pentoxifylline appeared to be capable of influencing several of these factors simultaneously. And that led to it being researched and studied in venous leg ulcers, allomeal venous leg ulcer, diabetic foot ulcers, ischemic wounds, and limb salvage programs. And although evidence varies by the condition, right, the drug has become a popular, familiar tool in vascular and wound care practices around the world. Now, the problem with blood flow. So imagine trying to water a garden using a hose filled with mud, right? The water may technically be flowing, but not enough to reach the flowers. This is exactly what's happening in many of our diabetic patients. The issue isn't always a complete blocked artery. Sometimes the problem is the blood is really thick. There are stiff red blood cells. There's inflammation because remember, diabetics are always in this constant state of low inflammation, right? Small vessel dysfunction and impaired oxygen delivery. And diabetes damages circulation at multiple levels. They narrow the large arteries, the small vessels lose their function, and the red blood cells become less flexible. And the end result is that the wound becomes oxygen starved. And that's why we say oxygen is our healing currency. We need oxygen, right? And that's why I told you, I'm a firm believer. I love me some topical oxygen. And without oxygen, the fibroblasts struggle, the collagen production fails, the immune function weakens, angiogenesis decreases, and healing slows down dramatically. So, like I said, Pentoxifylline is FDA approved for intermittent claudication. So, when patients describe, I can walk for 2 blocks and then my calves start burning. That's when our eyes and ears go up and we're thinking intermittent claudication, but you need vascular evaluation, okay? But Pentoxifylline was designed to improve circulation and help with your walking distance, but researchers eventually discovered the effects go far beyond claudication. So, what does let's go about the mechanism of action exactly what pentoxifylline actually does, okay? Because it's quite different, okay? Think of it as a lubricant for circulation as well. So, one is it improves the red blood cell flexibility. So, healthy red blood cells are quite flexible. I call them gymnastics, okay? They are contortionists. They squeeze through the capillaries smaller than themselves. In diabetic patients, their red blood cells become quite stiff, and pentoxifylline helps restore that flexibility, and this allows the cells to travel through these small vessels more effectively. It also decreases the blood viscosity. Viscosity, like I said, is thickness. Honey flows slower than water. So our amazing diabetic patients, their blood behaves more like honey. Pentoxifylline decreases that viscosity and helps with the microvascular perfusion. Next is it reduces the platelet aggregation. So platelets love to stick together. They they like to stick together, and sticking together can impair circulation. And pentoxifylline reduces platelet clumping, and that helps improve the blood flow as well. Next, like I said, the beautiful anti-inflammatory effects. So chronic inflammation is a major reason why a lot of wounds fail. Pentoxifylline reduces inflammatory mediators such as our amazing TNF alpha. So one of pentoxifyline's most interesting properties is the ability to reduce the production of tumor necrosis factor alpha, TNF alpha, major inflammatory cytokine. And in chronic wounds, a lot of our chronic wounds has excessive tumor necrosis factor alpha, TNA alpha, and that can help that TNA help TNA alpha help the wound be trapped in this prolonged inflammatory phase, and that leads to tissue destruction and delayed healing. And so, by reducing tumor necrosis factor alpha activity, pentoxifylline may help shift the wound environment from a chronic inflammatory towards the tissue repair phase and regeneration. So, pentoxifylline doesn't just improve blood flow; it may help calm the inflammatory storm that is preventing the wound from healing. It also helps reduce other inflammatory mediators that are interleukins and other cytokines, okay? Remember, less inflammation does help improve healing potential. So why does this matter to us when it comes to diabetic foot ulcers? Well, like we said, a diabetic foot is often a perfect storm. It has neuropathy, has poor circulation, it has immune dysfunction, has mechanical pressure, has bacterial contamination. And pentoxifylline targets one of the major components, which is microcirculation. Microcirculation is the movement of blood through the arterioles, the capillaries, and the venules. And this is where oxygen exchange occurs. Even if a patient has palpable pulses, microcirculation in that patient may be severely impaired, and this is where pentoxifylline may help. And like I said, it's approved by the FDA for intermittent claudication. So, venous ulcers and pentoxifylline. I love venous ulcers as well. So interesting enough, some of the strongest evidence for pentoxifylline comes from venous ulcers. And researchers found that pentoxifylline combined with compression therapy have improved healing rates. Why? Because venous ulcers involve inflammation, poor oxygen delivery, and capillary dysfunction. And pentoxifylline addresses all three. And many wound care centers still use it as adjunctive therapy for venous ulcers, okay? Now, peripheral arterial disease. This is one of our biggest enemies when it comes to limb salvage, peripheral arterial disease. We already know peripheral arterial disease reduces the blood flow, especially to the foot, right? The peripheries, right? Our patients usually experience claudication, rest pain, non-healing ulcers, and even gangrene. And pentoxifylline cannot open a severely blocked artery. It cannot, okay? But let's be very clear. It is not a substitute for revascularization. That's why we always need vascular. It's not a substitute for angioplasty or bypass. But however, in selected patients, it can help improve microvascular flow enough to support healing. But I would leave that to the vascular doctor, okay? Now, our healing cascade. So normal healing requires hemostasis, so stop the bleeding. Inflammation does require we do ha- that is a required state, okay? That inflammation that brings all the big dogs there, cleaning the debris. And then we go through the proliferative stage, which is helping build our tissue, and then the remodeling phase, which is strengthening the tissue. Think of modeling phase is like you're already there, but you're maintaining it and you're strengthening it. So, but toxoplasma may influence every stage through improved oxygen delivery as well as reduced inflammatory burden. So, a wound may receive more oxygen, will heal better. Now, when it comes to dosing, the doctor may put you on the most common adult dosing for toxoplasma. It seems like doctors prescribe is 400 milligrams orally 3 times a day with meals. Okay, but I would just go by what vascular recommends, okay? Many patients start with this as a standard regimen because food can reduce gastrointestinal side effects, okay? Especially patients with significant kidney disease, medical intolerance, or fragility may require a dose adjustment. Leave it to the vascular doctor, okay? That's what I do. Okay. The classic detoxifying prescription is simple 400 milligrams 3 times a day. Take it with food. Okay. So, what are some of the common side effects? Nausea, vomiting, upset stomach, dizziness, headache, flushing. Makes a lot of sense. And most of these side effects are mild and improve when you take it with your food, right? Less common, but very important, hypotension. That is a important side effect, okay? Palpitation, bleeding risk, especially with if you have it added with anticoagulants and rare allergic reactions. And what are some of the contraindications or precautions when it comes to petoxifylline? It should definitely be used cautiously in patients who have had a recent cerebral hemorrhage, any retinal bleeding, significant bleeding disorders, severe hypotension, or any allergy to xanthine derivatives, because pedoxyphylline belongs to that xanthine family, and the caution may be warranted for these patients who are sensitive to caffeine-like compounds. So keep that in mind, because like every medication, pedoxyphylline isn't for everybody. Better blood flow is helpful, but not if the patient is actively bleeding and is causing more harm than good. So leave it to the experts, right? So researchers have explored petoxyphylline in diabetic foot ulcers, radiation injuries, chronic wounds, kidney disease, liver disease, vascular disease, fibrotic disorders. And like I said, a fascinating effect is its effect on TNA alpha. Let's do a quick clinical case. Imagine a 67-year-old patient, diabetes, neuropathy, PAD, and a chronic plantar ulcer. The wound stalls, no infection, offloading is excellent, blood sugars are improved, yet healing has plateaued. The vascular team determines that revascularization is not currently indicated for the patient, so adjunctive therapies are considered. One of the options that was discussed with the patient was petoxyphylline. Why? Because the goal became optimizing every possible aspect of the patient's microcirculation. So, like I said, why isn't everybody using it? Okay, that's a great question. The answer is quite multifactorial. So, modest effect, it's not a miracle drug. Okay, variable study results, not every study shows dramatic improvement. Newer technologies in the wound care world, we have skin substitutes, growth factors, cellular therapies, hyperbaric oxygen therapy. Petoxyphylline can be often overshadowed by all of these. Okay. So, what does the future hold for petoxyphylline? So with the beautiful world of advanced wound dressing, cellular tissue products, revascularization, compression therapy, nutritional optimization, and hyperbaric oxygen, this is an era of wound healing that is becoming increasingly multimodal, like it's multifactorial, okay? And no single therapy just save limbs. It's teams that save limbs, okay? So let's do a quick rapid fire on petoxyphylline. True or false? Is petoxyphylline an antibiotic? False. Is petoxyphylline, does it improve blood viscosity? Yes. Does it replace vascular surgery? No. Can it improve microcirculation? Possibly. True, possibly. Leave it to the vascular. Does it have anti-inflammatory properties? Yes, true. Is it commonly used for intermittent claudication? Yes, it is FDA approved for intermittent claudication. So when we talk about circulation, most people think about arteries, but healing happens down to the capillary level. The smallest blood vessels often determine whether the wound closes and whether amputation occurs. And petoxyphylline reminds us that wound healing is not just about opening the arteries, it's about delivering oxygen that every cell needs, gets it, okay? Petoxyphylline was never designed to heal wounds. It was designed to help blood flow better. But when scientists that the red blood cells could squeeze, right, through these small highways, they accidentally created one of the most interesting drugs in medicine, vascular medicine, a medicine that reminds us that sometimes the key to healing a wound isn't just healing the wound itself, but also changing the river of blood flow, right? The flow of the river of a blood flow through it, okay? Pentoxifylline may not be the most glamorous medication in wound care, but it doesn't matter because it does what it needs to do, okay? And sometimes limb salvage isn't about a dramatic intervention. Sometimes it's about making your blood flow better. We already know people are harping down on vascular. I love me some vascular. And oxygen delivery helps as well, okay? That's what we need. Oxygen is our healing currency, and we're just giving the body one more chance to help heal. And in wound care, one more chance means the difference between healing and amputation. So thank you for listening for another episode of Diabetic Foot Files. I'm Dr. G. Every wound has a story. Every limb deserves a chance to save and to be healed, and every step is saved by changing a patient's life. So this is Diabetic Foot Files. Take care of your feet because they take care of you.